issue of private healthcare in Alberta has really been a hot topic lately. Earlier this week, we learned that clinic in Calgary is not going ahead with its plan to have a membership for care program because it actually goes against the Canada Health Act. But there is a new clinic in Camrose where patients are paying for their appointments. Our Michelle Bellefontaine went to Camrose and she joins us now. So Michelle, we have this brand new clinic in Camrose. Patients have to pay. What is going on here?
Well, first of all, Nancy, what's going on here isn't against the Canada Health Act, which ensures Canadians don't have to pay for insured services. What nurse practitioner Miriam Neufeld is offering isn't considered an insured service, even though the services she offers are the same as what you would get from a family doctor. So she can't bill Alberta Health or receive compensation from the government like doctors can. Yet her clinic, called The Art of Caring, provides primary health care to people in Camrose where, like in every other area of the province, there is a shortage of doctors.
We have people that go to the emergency department for prescription refills because they can't get into their family doctor or they don't have a family doctor and they need their medications for, blood pressure or diabetes because that keeps them out of the hospital. But that really increases the stress on our emergency department and our emergency services and actually increases healthcare costs.
So Neufeld can diagnose and treat illnesses and minor injuries. She can prescribe medication, order tests, and monitor chronic illnesses, much of what people see their family doctors for.
So you were out at her office. What's it like?
Well, exactly what most medical practices look like. It's a storefront close to downtown Camrose. There's these big windows that fill the waiting and reception areas with morning sunshine. There are 2 examination rooms, and there's a reception desk where you see a list of her services and the prices. And there is also a debit machine ready to take your payments. Now, first visits cost about $60 for a half an hour, $120 for a full hour. And after that, the cost of a standard appointment are $25 each.
Okay, so I'm curious, why can't the government pay her for her services? So especially because, she is a legitimate and she is a trained healthcare provider.
Well, that is certainly a question the Nurse Practitioner Association of Alberta is asking. They're seeking a pay arrangement where nurse practitioners can earn a living and also cover the costs of their staff, their office space, and other overhead. Now, the association presented the government with a proposal 18 months ago, and that seems to have gone nowhere so far.
There's over 800 nurse practitioners licensed in Alberta that would be able to address the primary care crisis. And unfortunately, we have not been able to harness that interest with the government to date. It's actually quite shocking to all of us because we now are in a situation where when physicians are leaving the province, clinics are closing, and nurse practitioners are actually out of work.
What does she mean by they're out of work?
Well, just to be clear, they are working, but they're working as registered nurses and not as nurse practitioners where they could do so much more. Now, in Alberta, most nurse practitioners work as employees in primary care clinics and hospitals and doctors' offices. And often the only way for them to do everything they're trained to do is to set up their own practice like Neufeld did. But they can't get paid unless they actually charge patients a fee.
Okay, so Michelle, what does the government have to say about this then?
Well, the press secretary for Health Minister Adriana LaGrange says there has been progress, but any agreement for nurse practitioners will be complex, he says. LaGrange and Premier Daniel Smith are meeting with the Nurse Practitioner Association soon, so maybe new leadership in the health ministry will push the issue forward. A new payment deal would make Miriam Neufeld happy because she believes in public health care and she doesn't want to have to charge her patients. Nurse practitioners have their own clinics in other provinces, and she says allowing them here would help solve in part the current crisis in healthcare.
So I'm from this area. I love this area. I want to stay in this area. And so I do think that when we look at that, there are lots of phenomenal nurses that I've talked to that would love to do their nurse practitioner and are from the community as well. And they would love to be able to provide this type of care.
There's something to be said about being able to stay in the community, right? And to be able to help the people that you're surrounded by and not have to potentially leave, right?
Exactly. And she's from there. She has no plans to leave. It's her home.
Yeah. Very interesting. Michelle, I know you'll be keeping an eye on this and keeping us updated. Thank you so much.
You're welcome.